Hello, I'm Dr. Sally O'Neill, Associate Dean for Continuing Medical Education, Creighton University School of Medicine. I'd like to introduce Jeff Klein of the CME Division, Dr. Mark Malesker, Liaison to CME from the School of Pharmacy, and Father Jim Clifton of the Creighton University Jesuit Community. Each of us is connected in a different way to CME, but all of us are affected by the Ignatian values. The Creighton University School of Medicine, Medical Center, and CME Division have a distinctive mission and voice. And the values that come to us from St. Ignatius of Loyola, founder of the Jesuits, are at the heart of that distinctive voice.
St. Ignatius established the first Jesuit school in 1548 in Messina, Italy, and today there are some 500 Jesuit schools worldwide. St. Ignatius was a soldier, a military leader, and he had a strategy in mind. He wanted to bring together the very best academic training with the kind of faith vision and values that would enable Jesuit graduates to make the greatest possible impact in the world. He wanted to influence those who have influence in order to multiply the effect of his schools. Generations of Jesuit students have been taught to write the letters A, M, D, G at the top of school papers. Ad Maiorem Dei Gloriam, for the greater glory of God, sums up that Ignatian dynamism. Creighton's Division of Continuing Medical Education is in a unique position to continue that dynamic mission among the practicing physicians and other healthcare practitioners who make up our CME programs. By including Ignatian values in CME programs where appropriate, we express the university's mission and we further differentiate our offerings. In the next few minutes, we would like to introduce 5 core Ignatian values which might already be part of your CME program or which might be applicable and easily included. After introducing and explaining these values, we will suggest some possible clinical applications for each.
For Ignatius, scientific research is in itself a fitting way to pursue the glory of God because it explains the wonder and complexities of God's creation. The clinical application of research touches the human family in profound and transforming ways and is inherent to the Ignatian mission. In this sense, everything we do at Creighton University Medical Center and in CME is fittingly Ignatian. Let's now turn our attention to the 5 core values.
The first core value comes from the Latin phrase cura personalis, which means broadly care of the whole person, body, mind, emotion, and spirit. It necessarily includes concern for the uniqueness of each patient and care for the context of the person or patient. That context might include family, socioeconomic, cultural, or religious considerations. Some possible applications to CME include issues surrounding informed consent, decision-making capacity, advanced directives, or surrogate decision-making, depression as a complication of injury, surgery, or illness, social, spiritual, and psychological support for patients, integrative or holistic medicine, adaptation of clinical practice to cultural or religious need of patients. For example, bloodless surgery for Jehovah's Witness patients, preparation for death or care of the body following death, sensitivity to modesty issues for patients of different faiths, cultural patterns that compromise patient self-determination, and culturally diverse understandings of immediate family.
Special concern for those most in need is the second core value. Which patient populations are underserved or difficult to serve? Or which populations do others not want to serve? Which populations require cultural adaptations so that they may be properly served, or pose language barriers, or require special sensitivity? Which populations suffer disproportionately from a specific disease or condition? It's important to think broadly when considering this, as those that are most in need are oftentimes the most vulnerable. such as those at the beginning and end of life, or those whose disease or condition may be rare or difficult to treat. Some possible CME applications include issues in high-risk pregnancy, end-of-life care, palliative care or hospice care, special needs of homeless or transient patients, treatment strategies for patients whose situation is complicated by chemical dependency or mental illness, healthcare challenges of newly arrived immigrant populations, approaches to care for those who are profoundly developmentally disabled.
The Magis, a term used by Ignatius, captures the third core value. This term refers to more, better, most effective in all things, and is explicit on the constant improvement. Some examples that would apply to CME include education about structures or methodologies for evaluating outcomes and using that data to improve outcomes. Programs that educate about total quality measurements or consistent quality improvement or some other relevant quality measures or standards. Programs that offer education in new techniques that reduce pain, expense, complications, readmissions, hospital or clinic-acquired infections, or length of hospital stays.
The fourth core value involves a commitment to doing that which we are uniquely able to do. St. Ignatius asks us to reflect upon what is distinctive about our skills, our resources, our values, our approach, our motivation, and to let those be central to our efforts. One of the things that makes us distinct among health science schools and CME programs is our very comprehensive, clinically based Catholic ethical tradition. We are in a unique position to bring together excellence in health science research, clinical practice, and ethical reflection. This is particularly important because there are only 5 Catholic medical schools in the United States. While some of our ethical reflection is specifically Catholic, much of our reflection and teaching is broadly applicable to the plurality of people involved as practitioners or recipients in healthcare. There is no other ethical system in healthcare that is as comprehensive or clinically based. We are in a unique position to combine excellence in health science education, clinical practice, and ethical reasoning. Some possible CME applications include decisions about withholding or withdrawing life-sustaining treatments, approaches to providing clinical ethics consults to patients, families, or healthcare teams, the special status of nutrition and hydration as medical interventions, pain control, especially for severely compromised or dying patients, experimental treatments or research involving human subjects, ethical issues in neonatology, ethical dimensions of national and international healthcare policy, ethics of healthcare finance and access to healthcare, the ordinary, extraordinary measures distinction and how to analyze a particular intervention for a particular patient, organizational and institutional ethics.
The fifth core value is a concern for justice. Clinical care is inherently concerned for the individual patient. We are very much aware that social, economic, and legal issues profoundly affect the availability of even the most basic care for a growing number of people. Some possible applications to CME include research into education about and advocacy for institutional, corporate, and national and international policies touching upon access to health care. Broader issues that marginalize particular patients or groups of patients, societal and economic realities or institutional policies that promote or impede opportunities for diverse populations to train or work in healthcare professions, and the challenge of providing health care for undocumented immigrants and other key issues in healthcare reform.
Thank you for letting us talk to you about the possibility of including Ignatian values in your Creighton CME program. If you are interested in including one or more of these values in your program, please contact the CME division and we will provide you the needed resources.
Even if your presentation does not lend itself to the explicit inclusion of one of these values, we want you to know that your CME program is inherently in keeping with the dynamic Ignatian mission of Creighton University, its medical center, and its Division of Continuing Medical Education. Thank you for being part of this dynamic Ignatian heritage.